giving a presentation on the factors affecting the development of fetus, especially the drugs that are there that affect the fetus. So we all know that motherhood is a very beautiful thing that happens in a woman's life, and the child between a mother and the child is the bond that they have. It's very beautiful. Whatever the mother eats in that during the pregnancy period, everything is trans goes to the fetus also. The even the drugs, whether it's required for the mother, if she has a condition, even if she's taking because of a condition, or if she's taking it for any recreational activity or whatever, everything is being transferred from the mother to the fetus through the placenta, as we can see it in the diagram over here, that there are some placenta is the connection that is between the mother and the fetus through the small villi that we have over here. So everything the mother eats, the nutrition and everything that's being transferred to the fetus from here, as well as the drugs whatever we have, it is not that it doesn't cross the placental barrier. It definitely crosses it, and it causes a very big problem in the later stages also. Now, the effects of drug can usually causes premature babies, underweight babies, stillborns, and various other birth defects. Now, exposure to drugs such as marijuana, now weed is there. We also call it as ganja and all. It can cause problems in the behavior of a child in the after it's born. It can cause the drugs can cause problem in the child's memory, its attentiveness. We usually know that there are, I'll classify the drugs basically into three types. That's we have opioids, we have cannabinoids, we have cocaine. These all infects either our brain or our neurotransmitters like the dopamine that transfers the information, or it infects our central nervous system, which can cause the euphoria-like situations or hallucinations, or it can help in increment of the energy, because these are the some normal effects that that drug can cause in a normal human being. Now, imagine the effect that it could have when a mother is pregnant and she's taking it, whether intentional or not. So it can cause a very big problem to the child also. Now, drugs like cocaine and methamphetamine increases the risk of miscarriages early in the pregnancy. Babies exposed to cocaine have high risk of birth defects that impact the urinary tract or the heart. It can lead to some cardiac complications. Now, fetal development it can cause the problems in development stages of the fetus, like it can have a abnormal growth or alternations in the neurotransmitters. Brain organization can also be affected. Uh, the mother who is taking drug during the pregnancy, after the baby is born, they also suffer from the withdrawal syndrome after they are being born. They also suffer from the withdrawal symptoms of the drug. And as well, we know caffeine is a very common thing that's available in the coffees and chocolates, and it's available in various other products that we usually have, but it should be also taken under control as it can. As this area is being researched, like how much effect it causes to exactly to a child, but there is not certain data that I got. So that's why I didn't do more about the caffeine part. Now, these are the various drugs that overall affects the child. Now, I'll start with the psychostimulants. These are basically psychotropic substances with the capacity to stimulate the central nervous system. It causes excitation and elevated mood, as well as increased in the energy and arousal. It is basically, it gives some signals, speedy signals to the brain, and it's used in the treatment for ADHD and some psychiatric disorders. So if taken, not actually, I mean, it should be if a mother is having some problem in the psychiatric disorders, it should be highly and if she is taking the drugs, it should be recommended by the doctors. She should be in a proper uh, checkups. She should have a proper conversation with the doctors, as we can see, it can cause various problem with the preterm labor. There are some short and as well as long-term growth defects. Cardiac and cardiovascular anomalies will also be there. Cranial and brain anomalies are definitely there, and later stages it can cause the behavioral problems. Now I'll come to the next one is the caffeine. It causes in some prematurity and well obviously excessive uh, like high energy in the child. Now cannabinoids are usually the drugs that affects the brain in case of a normal human, but if taken by the pregnant women in children in fetus it can cause decrease in the growth, deficits of attention, increase in impulsivity. There could be in future there could be highly problematic for the child, it will like weight loss and all, and depressions can also be there. Now I'm coming to opioids. It causes a neonatal abstinence syndrome. That is basically that happens when baby gets addicted to the drug even before the birth, and then they are suffering from the withdrawal syndrome of the drug after the birth. Symptoms usually begin shortly after the birth and it can lead stay up to several weeks. Like it for symptoms in the neonatal could be like some tremors could be there, like vigorous shaking, irritability will be there. The child will have trouble in sleeping, and excessive cryings will be observed. Now I'll move to tobacco. We know it is usually, the source is usually the smoking, and whether we smoke directly or not, like we are active or passive smokers, it is a very big problem for a pregnant woman. It causes decrease pregnant woman as well as the fetus. It will cause decreased birth weight. Some responses could be altered. Academic achievement will be poor in the later stages. After the child is born, there could be attention deficit and hyperactivity disorders could be seen. And adolescence aggression is also observed at times. And the last is the alcohol that causes premature and spontaneous abortion. Some limb and facial development problems do happen in there. Some cognitive delays could also be observed. It reduces the brain volume, like the microcephaly that was elaborated by Lakshmi Priya in the previous slide also. So these are the basic drug that causes effect in the mother as well as the fetus during the pregnancy. Now I'll move to my next slide. Now there are various factors. These are overall the factors that affects the mother the pregnancy. I'll start with the smoking a bit more. Like smoking can cause placental separations from the womb too early. That can cause bleeding. Now, at times, the water breaks happen too early, which could lead to deliver the child before the actual delivery date. And the babies are born too early. Sudden infant death syndrome could be seen. Fetal death is observed. So these are the risk factors of smoking. Now I'll try to present the video about the smoking. Just a minute. Just a minute. I'll share my screen again.